Hi, I'm here with Bonnie, who is a patient at Illinois Neuro and Physical Rehabilitation, and we wanted to talk to her a little bit about her progress since she's been coming here since August, and we wanted to share her story for everyone so they could hear what has been going on with her and her treatment. So Bonnie, what brought you here to our office?
Actually, I was going to physical therapy for some balance issues, and my physical therapist recommended Illinois Neuro to me and said that they did great things for her and her balance issues, and that's what brought me here. And then also, I have a diagnosis of multiple sclerosis, and I am not inclined to take conventional medications, so I'm always looking for any alternative therapies to help.
Okay, great. So besides the physical therapist, were there other places that you sought treatment, or was that kind of the first place you started with?
When I was diagnosed, I saw a neurologist, and he right away wanted to put me on medication, and since I didn't want to do that, I stopped seeing him, so I saw him once. And in 2013, I actually went to Panama and had stem cell therapy for my multiple sclerosis.
Okay. So the symptoms that you were having, besides the balance, was there any other symptoms, or was that the main reason why you came?
It was mostly balance and like coordination type issues.
Was that impacting your daily life?
It was affecting my sense of, I guess, confidence in doing things.
Mm-hmm. Okay, so when you came here to Dr. George Michaelopoulos and Dr. Matthew Imber, how was it different, or how was your first experience with them?
I guess my first experience with them was it kind of made me feel bad about myself because when Dr. Matt first had me do the eye test, which I don't know.
The VNG?
Yes,
Mm-hmm.
correct. He said, "I don't know how you're walking." And I thought, like, it wasn't really that bad. And then when I heard that, I was like, ooh, guess I really need this.
A little shocking.
Yeah.
But their ways were a little bit different than your conventional, traditional medicine.
Definitely. We never talked about medication. It was always about alternative, different things, like more natural things that can help me, changing my diet, things like that. And it was all, I feel like I've learned so much through coming here, more about my disease, more about ways to treat my disease more naturally, which is what I want to do.
So you're doing with changing your diet, supplements, and different exercises within his care.
Correct.
Great. And I heard recently they did a follow-up VNG, and how did that work out? So the first time was a little shocking, and now how are you?
He actually said, "You're like 150 times better," and I said, "So I'm normal." He said, "Not completely normal, but pretty close." And so, and actually Dr. George called me on New Year's Eve to tell me that one of the blood tests that they did, which shows inflammation in your body, which MS is inflammation, showed no inflammation.
Oh, that's great.
So it was very, very, and that definitely shows for him to call me on New Year's Eve. They really care about their patients, and you definitely feel it here. All the staff is very caring and nurturing, and
that's great.
They treat you like kind of like your family, not like you're a patient. They have 15 minutes in and out, and you're done.
Well, that's nice to hear, because that helps with wellness all around.
It does.
And how is your balance, and how are you feeling when you're at home and with your family? You're feeling more hopeful, more positive?
Yeah, I actually feel pretty normal. If that's really possible.
Yes. Great. Well, thank you so much for sharing your story. We really appreciate it, and best of luck in the year 2015.
Thank you very much.